The operating room in chaos. Machines shutting down. Doctors absent. Patient bleeding out, fast. A small nurse gets pushed aside. "You don't have authority!" But she doesn't back down, holding pressure on the wound while directing her colleagues. 5 minutes later, monitors light up again. Patient stabilized. The chief surgeon walks in, speechless. My God, she saved the entire surgery. Clara Jameson, 29 years old, long brown hair pulled back neatly, small frame, works as a nurse in the military hospital. Every day she arrives early, checks instruments, cleans operating tables, organizes medications. She's devoted to post-operative care, sitting for hours beside patients' beds to comfort them, recording every unusual sign in detailed medical records. But many doctors still see Clara as just support. You're quick and efficient, but surgery is doctor's work. Don't intervene too deeply. You don't have the authority. Once, during a cardiac arrest emergency, Clara jumped in with CPR, keeping the patient alive until doctors arrived. Afterward, they simply said, "Lucky we got there in time." Clara smiled gently, didn't argue back. Real human detail. A patient later said, "I felt her holding my hand all night, whispering, 'You're going to be okay.'" People see her as an ordinary nurse. But to me, she's the reason I'm still breathing. The truth was, Clara had more training than anyone realized. Before joining the military hospital, she'd worked in trauma centers in Detroit. Gang violence, car accidents, overdoses. She'd seen everything that could go wrong with the human body. But more than that, Clara had grown up as the daughter of a paramedic. Her father brought home medical textbooks when she was 10 years old. By 15, she knew more about emergency medicine than most first-year medical students. Clara, her father used to say, sometimes the difference between life and death isn't knowledge. It's courage to act when everyone else freezes. She'd chosen nursing over medical school for personal reasons, wanted to work with patients directly, wanted to be the steady presence in their darkest moments. But she'd never stopped learning. Reading medical journals, watching surgical videos, studying advanced procedures in her spare time. The doctors at the military hospital saw a dedicated nurse. What they didn't see was someone who could probably perform half their procedures herself. Clara preferred it that way. She didn't want the pressure of being in charge, didn't want the responsibility of making life-or-death decisions. She just wanted to help people heal. Until that day when helping people heal required taking charge whether she wanted to or not. That morning started like any other. Clara arrived at 0530 hours, checked supply inventories, prepared 3 operating rooms for the day's surgeries. The biggest case was scheduled for 0800. Multiple trauma patient from an IED explosion. Extensive internal bleeding. Complex procedure requiring the chief surgeon's expertise. Clara laid out every instrument perfectly, double-checked the blood supply, tested all the monitors and life support equipment. Everything was ready. Everything was perfect. What she couldn't prepare for was the power grid failure that would test everything she'd learned and everything she was willing to risk. A major surgery, multiple trauma patient, severe blood loss. The chief surgeon was at a conference, leaving the case to a team of junior doctors. When they began, suddenly both main and backup electrical systems failed. Operating lights went dark. Monitors fell silent. The steady beeping disappeared. The junior doctors panicked. "We can't operate. Wait for senior staff." Someone pushed Clara aside. "Stay back. You don't have authority here." But Clara saw blood flowing rapidly. precious seconds ticking away. She lunged forward, hands pressing firmly on the surgical site, her voice steady and commanding. "Hold pressure here. Prepare IV fluids. Emergency protocols. Connect this power cord to the emergency outlet, now." Her colleagues looked confused, but followed her instructions. Within minutes, backup lights flickered on. Monitors beeped back to life. The patient's heart rate slowly stabilized. The entire room stood silent. Real human detail. A junior doctor later said, "We were shaking, but she wasn't." Without Clara, the patient would have died before the chief got there. What happened in those critical minutes was this. While the junior doctors stood frozen, Clara's training kicked in automatically. She'd seen power failures before in Detroit trauma centers, knew exactly which systems had battery backup, which ones needed manual restart, which emergency protocols to follow. But more than technical knowledge, she had something the others lacked: the courage to act without permission. "Get me the manual ventilator bag," she ordered a stunned technician. "You start manual compressions if his pressure drops below 90. Someone find the emergency generator switch. Hallway, outside, third panel down." Her voice carried absolute authority, not because of her rank, but because of her competence. The junior doctors had never seen this side of Clara. The quiet, supportive nurse had vanished. In her place stood someone who knew exactly what to do, and wasn't afraid to do it. "Ma'am," a young resident stammered, "shouldn't we wait for—" "This patient will be dead in 4 minutes," Clara cut him off. "Are you going to help me save him? Or explain to his family why you waited for permission?" The resident grabbed the instruments she pointed to. Clara worked with surgical precision, maintaining pressure on the bleeding artery, directing fluid resuscitation, monitoring vital signs, all while coordinating emergency power restoration. It wasn't just medical skill. It was leadership under pressure. The kind of leadership that saves lives when protocols fail and authorities aren't available. 3 minutes after the power failed, emergency systems came online. 4 minutes after the crisis began, the patient's vital signs stabilized. 5 minutes after Clara took charge, the operating room was functioning normally again. But everyone in that room knew. Normal wasn't what had just happened. They'd witnessed something extraordinary. A nurse taking command when doctors couldn't, a support staff member becoming the leader when leadership was needed most, and they'd all seen the results. A patient who should have died was alive and stable. The junior doctors looked at Clara with new respect, not as the helpful nurse who cleaned their instruments, but as the person who'd just taught them what real emergency medicine looked like. "How did you know what to do?" the resident asked quietly. Clara was already returning to her usual supportive role, checking IV lines, updating charts, organizing supplies. "Experience," she said simply, "and knowing that someone's life is more important than following the chain of command." At that exact moment, the chief surgeon rushed in. He stopped dead in his tracks. Patient stabilized, bleeding controlled, operating room back in order. He asked, "Who was directing things here?" No one dared speak, but every eye turned to Clara, her hands still stained with blood. The chief surgeon approached her, looked directly into her eyes, his voice hoarse. "You just stabilized an entire OR in minutes, something a whole team of doctors couldn't do." Word spread throughout the hospital. A nurse saved a surgery when everything went wrong. Some doctors were initially uncomfortable, but fell silent when they reviewed the complete medical records. Clara didn't claim credit. She continued caring for post-operative patients, changing IV bags, updating files, as if nothing had happened. That night, the chief surgeon wrote in his private notes, "Without Nurse Clara Jameson, the patient would certainly have died before my arrival." But the official report only stated, "Surgery successful, team stabilized the situation." Real human detail. An anesthesiologist remembered, "In the darkness, everyone panicked. Only her voice was clear and calm. Because of her, we found our rhythm again." The transformation was immediate and profound. Nurses throughout the hospital started seeking Clara's advice on complex cases. "Jameson, this patient's vitals look strange. What do you think? Can you check this surgical prep? Something feels off." "The doctors are busy, but I trust your judgment. What would you do?" Clara answered every question thoughtfully, professionally, but always deferred back to proper medical hierarchy. "Check with the attending physician," she'd say, "but here's what I'd watch for." The junior doctors who'd witnessed the power failure incident began treating her differently too. They'd consult her during procedures, ask her opinion on patient care decisions, include her in medical discussions that were normally doctor-only. "Jameson, what's your read on this patient's recovery? Do you think we're missing something here? You've seen more trauma cases than any of us. What are we dealing with?" Clara navigated this new dynamic carefully. She never overstepped, never claimed authority she didn't officially have, but she also never held back knowledge that could help save lives. A week later, during a particularly complex surgery, the lead doctor encountered unexpected complications. "Jameson," he called out, "you've seen cases like this before?" Clara stepped closer to the table. "Detroit General. 3 similar cases. The key is controlling bleeding from the splenic artery first, then addressing the liver laceration." The doctor followed her guidance. The procedure succeeded. Afterward, he approached her privately. "Clara, I need to ask you something. Your knowledge, your instincts, they're not typical for nursing training." Clara organized surgical instruments while speaking. "I read a lot, watch educational videos, learn from every case I see." "That's not just reading," the doctor pressed. "You have surgical intuition, clinical judgment. Have you considered medical school?" Clara paused her work. "Doctor, I chose nursing because I wanted to care for people directly. I didn't want the distance that comes with being the decision-maker." She looked at the recovery ward through the window. "But sometimes, caring for people means making decisions, even when you don't want the responsibility." The chief surgeon had been listening from the doorway. He stepped into the conversation. "Clara, what you did during the power failure, that wasn't just nursing. That was battlefield medicine. Leadership under fire." He sat down across from her. "I've been practicing surgery for 25 years. I've never seen anyone stabilize a crisis that quickly without formal surgical training." Clara met his gaze steadily. "Sir, I've been in emergency medicine for 8 years. Trauma centers, military hospitals. You see enough life and death moments. You learn to act instead of hesitate." The chief surgeon nodded slowly. "Never forget, Clara, what you did that day. It wasn't just medicine. It was courage." That evening, a new protocol was quietly implemented. During any medical emergency, Nurse Clara Jameson had authority to direct immediate care until senior physicians arrived. It wasn't announced officially, wasn't put in writing, but every doctor, nurse, and technician in the hospital understood. When lives were at stake, Clara's judgment was trusted absolutely. She'd earned something that couldn't be taught in medical school: the respect that comes from proving yourself when everything falls apart. The next day, The patient woke up, his family crying and thanking the chief surgeon. The chief only looked silently toward Clara, his eyes deep with meaning, then walked away. In the cafeteria, several junior doctors approached Clara's table, placing a cup of hot coffee in front of her. One whispered softly, "Thank you. We're still wearing scrubs today because of you." Clara just smiled gently, continued eating her simple meal. The chief surgeon walked by, stopped, his voice carrying through the quiet room. "Never forget. That surgery. We owe it to you." No ceremony, no applause. But from that day forward, when Clara entered an operating room, no one dared say, "You don't have authority here." The change was subtle but unmistakable. During medical rounds, doctors would pause at her station. "Jameson, what's your assessment of Room 3? Any concerns about the post-op patients? Your instincts on the morning surgeries?" Clara's input became part of the unofficial protocol, not because of her title, but because of her proven judgment. A month later, a new nurse asked Clara, "How do you know so much? The doctors treat you like, well, like one of them." Clara continued checking patient charts. "I don't know more than anyone else. I just pay attention. And when someone needs help, you help them. Title doesn't matter." The young nurse pressed. "But that day, with the power failure, everyone says you saved a man's life." Clara looked up from her paperwork. "We all saved his life. I just did what needed to be done until the real experts could take over." "But you were in charge. You gave orders to doctors." Clara set down her pen. "Listen. In an emergency, there's no time for hierarchy. There's only time for helping. If you know what to do, you do it. If you don't, you follow someone who does." She returned to her charts. The patient lived. That's what matters, not who gave which order. Later that evening, the chief surgeon found Clara finishing her shift. "Clara, I've been thinking about what you said, about choosing nursing over medicine." She looked up from organizing supplies. "Yes, sir?" "You made the right choice," he said quietly. "Medicine needs people who understand that healing isn't about authority. It's about competence and compassion." He paused at the door. "Never forget, you represent the best of what healthcare should be." Clara smiled. "Thank you, sir. That means everything. Some heroes carry stethoscopes instead of swords, but they save just as many lives. Some people are only seen as supporting roles, but when crisis strikes, they become the ones who keep entire teams standing strong." Clara Jameson, a small nurse, stabilized an operating room in minutes, before the chief surgeon could even arrive. He said, "Never forget. If you've ever witnessed someone quietly doing something extraordinary, leave a dot in the comments. And if you believe in stories that touch the heart, don't forget to subscribe to SN Quiet Stories channel. We tell the stories no one else tells, so that quiet heroes are never forgotten. Some heroes save lives with scalpels and surgical expertise. Others save lives with knowledge, courage, and the willingness to act when everyone else freezes. Both kinds of heroism matter. Both deserve recognition. Never forget.